You just had surgery and your doctor prescribed you, like we usually do, antibiotics and painkillers. You must be wondering at home, what can I do to reduce the pain? What can I do to reduce the inflammation or swelling? Well, the answer is a lot. You can do a lot at home. If you want to learn how to do it, just watch this episode. Hello everyone and welcome back to the channel. This is Dr. Fanny Yacaman and today we're going to share with you 6 essential and very effective tips of remedies or advice that you can take care at home. You will have the control, you can prepare it for you and make your inflammation get less and use remedies to avoid pain or try to reduce the pain without any pain medication prescribed by your doctor. And this is not about any other medications prescribed. This is about your remedies at home. Just keep watching our episode. Tip number 1, cooling the surface area. I'm pointing to this side, but it could be this side, or this side. How do you cool the surface area? Well, sometimes when we have surgery, especially if it was a difficult or challenging surgery, the area will get a little bit hot. Sometimes you don't feel it, sometimes you do. Whether you feel it hot or not, it's important that the first 24 hours you can place cold pads, or you can use a gel cold pad that they will be given to you by your dentist. Or you can actually, in a glove, fill it with ice and use it as a cold pack for you. Just remember to wrap it around with a cloth, otherwise you can burn the area. Some people think, oh, if I put directly the ice to my skin, will it work better? The answer is no. If you put it together with your tissue where the surgery was, in your gums, the answer is no. Why? Because you can literally burn that area, burn the gum, and cause inflammation again. So this is our tip number 1, to be cooling the area. Now the question for you will be, okay, how much time do I put on this? Well, the golden rule is you place the cold for 10 minutes and then you rest 20 minutes. Then you put the cold again and then you rest for 20 minutes. How many days? As long as you feel it hot, the area, you're gonna have to keep doing it. Basically, I would say maybe the first 12 hours is important, but sometimes we recommend 24 hours, depending on what type of surgery or how much inflammation you're having. So this is the rule. You're gonna do 10 minutes again, rest for 20 minutes, and continue to do it until you don't feel hot anymore or you don't feel pain anymore. And this can happen in a few days. Don't get desperate. This is the first 12 hours are very important that you have to follow up. Tip number 2, what is it? Keep your head up. Try to sleep with your head elevated. That is really important because the gravity that we are sitting and blood pressure are related. What is happening is when you are in a sitting position or elevated, you put a couple of pillows in the back, a cushion that you have at home that you never use and you can use it now, but keep your head elevated, so this will avoid that our blood supply goes to pressure on the surgical area. And why this is important? Because the minute that your blood supply is circulating correctly, your blood pressure is gonna be correct, you will not have more inflammation. This will reduce the pain and the inflammation together with your cold gel packs. But also it's important that at night when you're sleeping, typical that you can sleep over that surgical area because you didn't realize you were doing it, and the next day it's very common to hear that when you wake up you have a face that it was swelling more or you have bleeding during the night. So avoid putting your head, laying down the pillow, just keep your head up. That's our second very crucial tip. Moving on to tip number 3. What is it? Avoid at all costs caffeine. Why you have to avoid this? Because any caffeine in your drinks could be coffee, And I know for coffee lovers, this is a very difficult task, but you have to try the first 12 hours. Just avoid any drink that has caffeine, like energy drinks, any vitamin drinks that they all say they give you energy and they have caffeine. Any drink like sodas that have caffeine, any tea that has caffeine, anything that has caffeine. And why? You're wondering why? Because the blood pressure will spike up, the blood supply will go and exactly start accumulating again in your area of the surgery. Not in every patient, this is depending on patients. I have patients that they have it and nothing happens. However, please avoid, I advise completely, do not drink any caffeinated drinks to avoid any blood pressure going up and increase the inflammation again in the area. Also avoid any straw, taking anything, any drinks with a straw, because you're gonna suction the area and you can probably open the sutures. You never know with that movement what you're gonna do. You cannot do rinses and suction with the rinses. You can do rinses with salt water and then let it drop on the sink. Sea salt water is one of the best remedies that is an homeopathic and it's a natural remedy also, and it helps for inflammation and it helps for so many minerals that has the saliva, the salt, the sea salt mixed with water. Sorry, I said saliva. Anyhow, just follow no caffeine and make your rinses with sea salt water and no straw. Well, swelling lasts between 3, some surgeries they can say 14 days, but in general, the type of surgeries I perform in microscopic surgery, it will give you a couple of days maybe of the swelling. If you follow all the tips that I give you before, your swelling is almost gonna be nothing or very minimal. But it can last that few days. That was important that you follow the steps the first 12 hours after your surgery. If you don't take care of this, then the pain will last longer than even 14 days. The last one, but not the less important, this is one of the most critical tips that probably I will say that we manage in surgery, and it's nicotine ban. And it's not that it's just the nicotine, it's the cigarettes that people like to smoke. So for the smokers, they have to understand that the more you smoke, first of all, you're creating a suction, and second, when you're smoking, and second, the cigarette will decrease the healing process. The cigarette takes oxygen out of our bone, and the whole tissue area is gonna be dehydrated and it's gonna be more prone to any swelling, inflammation. People say you can get infections, but I have never seen anybody that get an infection because they were smoking after surgery. And as a matter of fact, I can tell you now, after all these years of practicing, that it's very general to see do not smoke, but I have one patient in my life that is extremely, extremely healthy, that I thought his surgery was gonna be a disaster because he likes to enjoy his dinners with wine and he likes to smoke. And what he does is, he argued that nicotine is gonna help for inflammation. He has all this research supporting, and I thought his surgery was gonna fail. But guess what? This is my only patient I can tell you where I saw the success, 99%. His area was healed. He's very healthy. I don't advise this to you guys to do it because it has to do with your genetic composition, your health of your body, your nutritional habits, the way you clean your teeth. In general, this is very difficult to really achieve. But this patient did it, and I was very surprised. So I cannot generalize now, but I said we advise the patients to don't smoke. And the other one is to don't drink alcohol. No wine, no any vodka or any whiskey or any brandy, any alcoholic beverage, because it will lower and it will decrease the healing process. So now that you have these 6 tips, please send me a comment, send me a question, tell me if you identify with one of them, tell me if this can help you if you just have surgery, and if you have any questions, any concerns, or any comments that we can do this channel better, please write to us in the comments after the episode. Thank you.